If you're building your ABA company and you're tired of guessing, this is for you. We built the EBCBA blueprint to give you real structure, systems, and support without the fluff. Details are in the description. Welcome, everyone. As usual, we have an awesome group of people. Sometimes we only have one subject matter expert, and today we're blessed with three. We've got MaKenzie, Ben, and Vincent from Ārohana, and MaKenzie is Director of Operations. Ben is the founder. Vincent, also a founder. Ben is the CEO. Vincent is CFO, correct?
Yep.
Awesome. Today, we're going to talk about scaling your ABA practice on a budget and like the big moving parts involved with that. So really, I know you guys know this material at the back of your hand. And what are you seeing out there? What are the biggest problems these ABA companies are running into?
Sure. I'll jump in. And I just think that the thing that strikes us right now, before getting to what's the biggest issue, is just the wave of folks who are looking to start their own practice right now, or who have recently started their practice, right? So I think it's undeniable that there's a movement in our space to say, hey, look, I think I can do this on my own. I can maintain clinical quality if I go out and do this on my own. I can control sort of staffing decisions and who we're going to be and what we're going to be about. I think that's a great movement. I think it's exciting to see that. We've been in this space for nearly 2 decades, and we've seen sort of these waves of things happen in the space. I think that's a really exciting movement. However, there are a lot of folks who are seeing what's happening at scale for maybe a PE-backed company or a larger privately owned company. And they're saying, great, I'm going to do all of those things day one in my new company. And they haven't taken the time to stop and say, to the cent, what do these things cost? And then what's my cash flow going to be? When can I get there? And hey, can I do some of these things a year from now, 2 years from now? And really doing the prior planning on that with consideration, not just for billing, but for their cash flow and the actual collections that they're going to have on that. And that's the thing that really strikes me, is saying, hey, maybe I'm going to take 6 months to plan before I even do anything. I think that's the challenge that I'm seeing right now for all of these startups.
What are they missing in their plans? Like most of the companies that I talk to, and we deal with hundreds of them every month. So like our team, the ABA Impact team, is having conversations with hundreds and probably a week. Talking about hundreds a week now at this point.
Yeah.
And then I get 24 that end up on a call with me and working on a serious problem. We're being audited. We're not ready. We've had some kind of catastrophic fallout with some part of the business. So what do I do here? And that's just my part, because there's other people that we pass off major issues to that are a clinical issue or an HR issue that's not even in my wheelhouse. But everything that I've addressed, I've basically nailed down to just not having a plan from day one and not having a structure to the business. But everybody has a mission statement. That's one of the first things, right? But we seem to be missing the gap between the where we're going and how we're going to get there. Like we have a visualization of where we want to be, but not exact. It's hazy. It's kind of on the horizon. And then we have our mission, how we want to do things. But like it's the in-between part that's missing. And there's a lot of consultants in the space that say, oh, we'll help you do all of that. Let me help you build an org chart. And they have an org chart that says like Jill and Tom and Frank. That's not an org chart yet.
Yeah. I would say like an org chart, it's hard to have an org chart when you're started. Like you do need to have an org chart. You need to plan out where that's going. But prior to that, you need to have a revenue model, and a realistic revenue model, not a, hey, here's what everything will look like when I'm at X, Y, or Z scale, or here's what everything could look like if I collect everything. It's a revenue model that says, here's the worst case scenario. And if that happens, am I okay? Do I have the cash on hand, or do I have the liquidity from a bank, or do I have the backer, right? Do I have the friends and family? Whatever that looks like, can I look at myself and realistically say, if this worst case scenario happens where I'm only collecting 60% in a month because I am getting audited, or I'm in prepayment review, or there's been a clawback from TRICARE because my notes weren't right, all of those things, in that scenario, do I survive? Right. And so that when those things inevitably happen, because they will happen, the worst case scenario might not happen, but the best case scenario probably won't happen either. There's going to be bumps along the way. Right. And so have I put those
Hopefully
things in my
middle
phone?
some.
Yeah, hopefully, right? And good news, right? And even that, right? Just the psychology as a founder of knowing, hey, you're going to take something, right? And every hit can't be the end of the world. And if you planned appropriately, and if you know those things are going to happen and they're in your plan, then when those things happen, you can say, saw that coming, right? And I planned for it and I'm ready for it. And so I think that's the thing, right? And that isn't just like back of the napkin math. And we can help with this. Other consultants help with this. It sounds like you guys can also help with this. It's saying, I have a spreadsheet and every item is in that spreadsheet. And I can look at it and say, this is when I'm going to be able to spend that. And this is how much I'm assuming I'm going to collect. And to the set, this is what my actual rates are. And here's how many hours I'm going to get out of those people. And I'm going to assume that 15 or 20% of my sessions get canceled because of course there's going to be cancellation. I'm not going to assume 100% of my sessions happen. And it's really an intensive weeks long process. And then it's something you go back and you refine every month and say, is reality matching what my assumptions were? Where is it? Where isn't it? And let me adjust with flexible equations that are built into my spreadsheet that will allow me to change and update as I go. Yeah. MaKenzie's laughing because I'm taking over. I'm going to be quiet now.
That's not what I meant. You give Ben a softball him a question and he'll talk for hours. But I think it's because not only do we feel like we're knowledgeable about this, we've done it ourselves. We've done it not just here in the US, but we've done this overseas in a lot of different countries as well, where we've supported BCBAs and entrepreneurs who are saying, I want to be able to focus on clinical quality, but also running a business is not what I thought it would be. Right? There's so much that comes alongside with the operations of it. I was actually just speaking with somebody earlier this morning who just said, I don't want to take over my billing, my RCM, but I want to know what's happening. How do I learn what's happening? And I think sometimes it's a matter of being willing to educate yourself to the point where you can know what's happening operationally, but you don't have to be the one to do it. But I think when owners and operators kind of step into roles and they're saying, okay, I'm still going to be over everything clinically, and I'm still going to be, or not still, but I'm going to add on operations and finances and hiring and all these different components. That's where we start to see the vision that they had slip away, sadly, and not meaning that in a bad way, but because we don't have enough knowledge to actually hold all these things. And so I think it's also a matter then of knowing, what do I as an owner operator, whether I'm in a startup, mid-sized company or larger, what do I want to own in terms of like my area of expertise that's going to launch the company forward versus where do I need to bring in either an SME, a subject matter expert on billing, on operations, on things like this, so that I can actually achieve the best case scenario, right? Like where you're actually running realistically at some of these things. And I don't think that often means a large org chart, because that's where I think people can get confused. Oh, I'm going to bring in this admin and this person, but then you have 10 people on payroll that are not revenue generating employees. And then you're having to cut these payroll for people that aren't actually helping supplement their own pay. And that becomes, I think, a challenge in and of itself to know, when do I offload or when do I bring somebody else in? And I think that's why these two gentlemen have put me in the position that I'm in a lot of the times, because that's the stuff I love to sit. I'll just sit for hours on a weekly basis and just talk through some of this stuff with whether BCBAs who are starting their own company or companies that already exist. And I'm like, let's just talk through what assets and resources do you already have that you're just missing, so that you're not bringing on additional staff or support that maybe aren't necessarily needed at that time. Because if you like overload your payroll with staff that aren't helping you achieve your revenue goals, you're going to run into a hard place where you just can't actually grow because you can't pay everybody. And so I think a lot of times it's that question of you don't know what you don't know.
Yes.
And so I think one of the things that, as much as all of us like to talk, which again, do love chatting with people on a weekly basis, it's like learning how to ask the right questions and prompting BCBA language, prompting people to start thinking about some of the categories that they maybe just haven't thought through yet. Like I just was chatting with a new startup last week where they're like, I know I need to post claims in order to get paid. What does that mean? They know
Yeah.
know it needs to happen, but I'm trying to think of how to say what I'm thinking nicely.
It's about divide and conquer. And I think we have a lot of BCBAs. I think we just lost MaKenzie. There's a lot of BCBAs who jump into this and they end up building themselves really stressful, overwhelming job instead of building a business. And most of it comes from, and there's actually someone on this call that it was in that situation a few weeks ago who was like, I got so much to do. And then every time I look into something, it just keeps expanding and there's more to do and there's more to do and there's more to do. And I'm not an expert in these areas. I don't know this. And the approach that I take with people is build the system to the best of your ability, right? Put your assumptions in there, map it out and put what you think it is, right? And then the systems, and then rate them by your level of confidence in each system, right? Just based on what you think each system is, how good it is, right?
Functioning.
Let's put a criticality label on it. Does it drive revenue? Is it going to get you paid? Is it going to mean the difference between getting paid and not getting paid? And then address those systems one by one. And at that time, you're ready to bring in that SME who can look at that with you or look at it for you, or you can outsource it to them. But it all comes back to 3 words. You are responsible, right? So if you can't make payroll, you are responsible. Your employees don't care that there was a clawback. Your employees don't care that you had a fire in the break room and you had to rip. None of that matters. Right. You have to make payroll. You have to make sure that the rent is paid or your mortgage is paid. Hopefully mortgage, because I like when people buy property. But anyway, getting into all this, but like divide and conquer. Don't boil the ocean. We had one of our guys is Egyptian and they have all these sayings, right? So don't try to boil the ocean. Take one pot, boil that, and then go back for the next pot when you're ready. But on the finance side, because that's really where I think people struggle the most. I work with an ABA company that they waved the consultant wand over the entire company and said, hey, let's bring in a consultant. And this consultant was like on the operations side in nonprofits, like literally worked for the Boys and Girls Club. And they said, oh, this guy's a genius. Let's just bring him in. But they had him doing HR stuff. They had him doing finance stuff because they were completely just out of touch with these areas. And they brought in the wrong SME to work on the wrong systems because they had no documentation. They had no issues. And they ended up going into a major hole financially because this guy didn't know how to manage their finance.
Yeah.
But those systems, when they're building them, what are the things that you see a good ABA company developing as far as financial safety nets? What do you see them doing on the risk management side of finance that works?
Yeah. And Derek, I want to let Vince talk. I think he should take this question, but I think you made a great point there about consultants. Like consultants can be incredibly helpful, but if you come to the consultant with no plan for what your needs are and just everything is on fire, what you end up with is just expensive, high-level advice about everything instead of solutions on the most pressing items. And I think that is where Vince comes in, because so frequently all of these other things you need to fix, you cannot fix if you don't have the finances.
I have an analogy for that. When my wife sends me to the grocery store, she must give me a list and she must also instruct me to only get what's on the list. Otherwise, I come back with $300 worth of crap.
Yeah.
Like I go for blueberries and strawberries and I come back with a truckload of groceries.
But
you have to have a plan. You have to have a directive for that consultant when they come in. Vincent, onto the financial safety nets.
Yeah, I think the financial safety nets you have to start by having, honestly, a really good connection with your bank, right? Go and learn that person's name. Go and talk to that person often. That's actually where I came out of. I started my career out at Northern Trust, and I was within PE. I was over not-for-profits and endowments as an account manager. I moved over to hedge fund servicing. I hated all of that, by the way, and jumped over 9 years ago with Ben and took this thing on without really knowing what I was doing necessarily within the realm of this thing. But what I immediately found was that if I had a really great relationship with my banker, I could lean on that person. I could go and find my line of credit. I could extend my line of credit. They often have different credit cards that you can utilize for CapEx that you can carry a balance on for a little while towards the beginning of your sort of growth. All of that stuff's super important to have. And then I think that beyond the bank, honestly, you have to be able to have these connections within your payers, right? So that you know that if you see an issue within a payer, you know who you're calling. And that's not always easy. In fact, I think that the payers make it tough on purpose. I've said that for a long time. If you were to call there for your insurance, you call the number on the back of your card, you're going to get someone who's competent, ready to help you, and wants to get you to the provider, right? Provider side calls, and we get the guy that started yesterday, has no idea what fire he has walked into or they have walked into, and they go, actually, I have no idea what's going on with the claims. And so the safety net on that is, one, again, a really good bank relationship and a line of credit, making sure that you have access to that additional capital, because again, like Ben said, it's going to happen where you're going to have to exercise those things. I think that the other really big thing that we have always done and that we have always asked folks about is watching your payer mix, right? Understanding your payer mix is going to have to be one of those financial safety nets, because if you understand your payers, you understand the timelines that they're paying on, you can kind of mess with your payer mix as you're taking your clients in to make sure that you're not too overexposed to someone who's going to be a slower payer and really problematic, versus maybe it's a payer with less rate per hour, but they're paying on time, consistent. It's very easy, accessible cash flow, right? And that's all stuff that I think has to be taken into consideration, because if you don't, and you end up on a payer that has a typical turnaround time of 45, 60 days, and you're fighting for that money, you've just paid your employees 3 payrolls minimum from the time that they actually work that date of service. And so that's, I think, the other thing is that we often talk about financial safety nets in the realm of a line of credit or a loan, or like Ben said, friends and family. But really, your biggest safety net is that revenue model, that budget, and understanding the cash flow within that budget. Because while maybe for March you bill $1.5 million, you don't see that $1.5 million in March. You'll pay for that $1.5 million within March and those first couple of weeks of April, but you won't see that until the end of April if you're lucky. And so understanding that is actually a really big thing too. We've seen a number of providers who got in too deep too quick. And what I mean by that is that they had such a long wait list and they just hired folks left and right, BCBAs, RVTs. They started doing services and they were on this moonshot rise. And then all of a sudden they realized they couldn't make payroll. And they can't make payroll because they grew too quickly and they don't actually have the cash. And so having a revenue model is the biggest, to me, financial safety net that you can do for yourself, in understanding your payer timelines, understanding, again, those issues that could arise, and understanding when you're actually going to see cash in the account. Because again, I think that we've all been around long enough to know that back in the day of what I like to refer to as free money coming out of PE groups, right? 2019 and 2020, it was free money. They weren't actually taking a look at the books, and everything that we kept hearing is, oh, everybody's doing a 25% net and 25+% and all of this. And I kept looking at Ben going, we're in human services business. That is a BS number. No one's doing 25%. Not when you add all those actual costs in and you can see what you're actually burning a month, that's when you know. That's when you know that you're shooting for 13% when you're mature, 15%. You're going to be really happy. That's going to make sense. But I think that having that and having that really good understanding of an actual revenue model, not just a budget, is imperative.
So, and I know this is a broad question, but rule of thumb, how much cash or line of credit should a business have on hand, and as it relates to payroll, right? Like how many payroll periods should they be able to cover as their safety net?
Yeah, you should have a safety net of 2 payrolls. Honestly, that's what you should be shooting for. You should be shooting for, if you have a disaster month, that you can carry everybody without even
length of time. So if they're biweekly, 2 payrolls. So you're saying a month, have a month of payroll out ahead of time.
At least. Look, it'd be great to have more, but I think that Vince is a realist and he understands that, like, if you can have more, if you're cash flowing really well, set some of that aside, have it there and available. But I think realistically, the spot that a lot of businesses are in right now, especially when you talk about care slowdown, some of that kind of stuff that's going on right now, I would agree, Vince. Like, if you don't have 2 payrolls, you're in a really dangerous spot.
Yep. And I went to business school and did all the finance classes and everything. The way I ran my business since 2009 was I always measured the health of my business based on how long I can go with zero revenue. Keep everything just like it is and go zero revenue. How long will I still be in business? Paying payroll, paying rent, keeping the lights on. And when COVID hit, there were all these companies that we get to see a lot of stuff happen during that time period. And at that point, I told my employees, like, listen, nobody's coming to help us. Turns out they did a little bit, but nobody's coming to help us. We're all going to have to stick together. I can keep this thing going for a year, right? If all of our customers go out of business, if everything falls apart, you guys put me in the financial position that I am in now. I'm not letting anybody go until I'm out of money. So this is what we're going to do. So let's do what we can. And luckily, it didn't turn out all that bad. But then Norwegian Cruise Lines comes out and they make a statement and their stock value skyrocketed after they said this. But they came out and said, we don't have to sail a ship for a year. And we've got enough cash on hand. We're not worried about it. We've got cash on hand for a year. And everybody went, oh my God, here's a safe place for our investment. And I think that's a good way to look at it just from an expense standpoint is, all right, how long can I get not paid anything for and still survive? And I think that's probably a good way to rule of thumb, calculate your cash flow health.
Yeah. It raises a really important question about who is listening to this, what stage are they in, what are their goals, right? So if I'm an independent BCBA, I'm going to have a caseload of my own and I'm going to hire 5 techs and that's it. It's a different proposition, right? You've got your LLC or your S Corp, however you set it up, and you're taking money out of it every month and you're flowing that way, right? Your personal finances will be what's responsible for salvaging that company in this situation where there's a year, right? And you have to implicitly build that trust amongst your team and that plan, right? Versus now I have 5 clinics. And I have 100 plus staff and my monthly obligations are significant. Plus I have signed personal guarantees, possibly, hopefully not, but possibly on these leases. Now you've put yourself in a far riskier position where very quickly you can go bankrupt. And I think to your point, Derek, that is where things like what Norwegian did are very important, which is stockpiling cash. And whether you do that in your business or in your personal finances as a solo owner, right, is really a tax consideration, I think, more so than does the business itself have it on hand? But yeah, absolutely. I hope for the best, plan for the worst.
Yeah. And I like what you said about worst case scenario. In our EBCBA blueprint, like our foundations course, we go through it and we'll say, here, find these 5 numbers. I want your highest rate of pay plus 30%. For your RBTs, your lowest reimbursement rate on 97153. And let's figure out all of your billable hours and what's required based on that terrible number, like worst case scenario across the board.
Yeah, absolutely. Because I think a lot of folks are going and starting their own practice for some really good reasons, but also based on some faulty information, right? And so I frequently hear BCBAs say, I know that where I was working, they were billing $95 an hour for me and $60 an hour for my techs. And so I could give my techs $50 an hour and I can just get paid $90 an hour and we'll be good to go. I've even seen this, even on places like LinkedIn, I've seen crazy memes around, here's what your company's getting paid and here's what your cut of that is. That cut should be yours. And I'm sure there's people on this call right now who are listening, who are in this spot of starting or recently started a business or maybe are farther down the road, who now inherently get that is just false. There are so many. You should be shooting for a 50% gross on your billable hour, right? At least a 50% margin on your billable hour, because between a cash flow slowdown and any lease or building obligations and benefits and workers' comp and unemployment insurance and liability insurance, all of the things, that other 50% comes quickly.
Yeah, I also want to say this, you can build a very successful ABA therapy business, and that's what we're here for. We're not here to discourage you from starting.
Jeez, that's a good point. That's a good point.
Our plan here is you need to have a safety net. It's a parachute to make sure that you have something that is going to keep you safe during these downturns, because you need to be prepared for the bad things. So I feel like I don't want to just talk about all the bad things and discourage people from doing it. And our role here, all 5 of us on this call, we're all here because we know there's a huge gap between
That's right.
the diagnosis rate and the BCBA certification rate. It's like this, and we're not going to catch up by certifying more BCBAs. We have to learn how to run our businesses at scale, operate, and push your mission out into the world and do it at scale. And I'm always encouraging people to do it, but the previous planning prevents piss poor performance. We got to make sure that we have a plan and that we don't go under, because these businesses could take over your life. They can hurt other people if they're not operated properly. And it's almost like getting a CDL, right? If you're going to go to get a CDL license where you can drive a semi truck, there's a lot more involved in that, because you're putting so many more people at risk. You have to understand how the components of the big truck work. You need to understand how the brakes work and all these things, right? So you can tell I'm a recovering garbage man. I ran a garbage company in my early years, but it's important to understand the components of the business, because you're operating a much larger vehicle now than just your career. And there's a lot of people that now you are responsible, like you're responsible for your clients, because if you fail, they're going to have to go back onto other people's waiting lists. Your people that are you're paying the rent and the mortgages of families that are working for you. So it's important to make sure that you have this stuff under control and that you can confidently look at a challenge. And this is the other thing. When you have a payer issue and cash flow hits, a cash flow problem hits you, how much of your time and how much of your energy is that going to suck up?
Yeah.
It's 100 times worse if you don't play.
Yeah, that's right.
It's going to be awful no matter what. It's not going to be fun. But if your boat sinks and you don't have a life jacket, you're done. If your boat sinks and you have a life jacket, it's still going to suck. But at least you have some kind of a plan. You have a way forward, and you can wait for the other boat to get there. But I think the financial planning, and I want to hear about your GCR, your calculator, does that involve some of I know it's cost management, right? So,
and before we get into that, I'm optimist of my team for the most part. Granted, Ben and I dream up new things like on a daily basis. And we have 2 other members, Vincent, one other person on our team, who constantly are like, but numbers, data, let's pay attention. I think there's a reason why, again, like we were excited to come on and talk about this, is because as much as planning needs to take place, and thank goodness I have people on my team that do that. I have a partner in my life that does it for me on my own, thinking about all the worst case scenarios, right? There's just so much capacity for success and for growth within this space. And I think at the end of the day, the reason why Vince, Ben, myself, and one other individual are doing what we're doing is because we see the possibilities if people are in control of understanding what they're operating. And I think part of that, again, and we'll get to the GCR stuff, but I think part of that is just knowing the word that I just thought of. Didn't that make sense? I'm really learning to think before I speak, which everyone here appreciates. There's just ways to go about growth and ways to go about financial success that offload some of that mental effort, if you can trust the person you're outsourcing to or offloading to, so that they can focus on some of these other things that actually yield growth, right? Which is connection with families, connection in the community, making a positive impact where each of these companies are located. But that can't be done without other people stepping in then to help them, right? Thing is, those things cost money, right? Payroll, we just talked about it. If you don't have a revenue generating employee, you really have to start considering what are the risks here when I'm bringing on and outsourcing my billing, outsourcing my HR, outsourcing my credentialing, things like that. And so that's where we've really come alongside companies and said, we have done this. We believe we are experts in X, Y, and Z categories. We can take this on for you so that you can focus on clinical excellence, so that you can focus on when is the right next step to bring on another BCBA, to get people off this wait list. But it's like you have to be able to trust the people that you're outsourcing to or that you're offloading onto to do that. And I believe we've been able to do that in such a way that it both makes sense financially for companies, from startups who are literally onboarding their first client to companies that are billing $1 million rev and claims them a month, right? We've been able to come alongside people in different ways that make sense financially. Because I think that's one of the biggest burdens is, as a BCBA, if I had decided 15 years ago in the state of Michigan, I can do this on my own, I wouldn't have known the first thing about billing at all. I wouldn't have known that it took 30 to 45 days to get paid, right? There's so much education that needs to take place. And I think that's one of the things that in a healthy way can be discussed of why does outsourcing allow you to scale maybe sooner than you would otherwise, because of the difference financially that it would take to do that versus putting somebody on your payroll. And so that's what I think the segue into what we also wanted to discuss of what does it look like to outsource to SMEs who can help scale your company in a way that is both affordable, and how companies who actually understand GCR can allow you to do that. Because every time I meet with a new company, I ask them, do you know what your GCR is? And a lot of people were like, what does that mean? And I'm like, I also once asked that question, right? It's like, you don't know what you don't know. And so we're trying to also educate owners and operators about a lot of the things that maybe are happening in the background of their companies that they don't even understand, right? So it's a matter of educating, but then also providing the answers to what need to be given in those areas of the gaps that exist for these companies. So that's what I wanted to say about that.
And that comes back to what you were saying earlier, is at least know enough about the system that you understand what the inputs and outputs are, what your KPIs are. You need to be able to measure these systems. You can't just outsource and forget it.
Holding those people accountable. So unfortunately, I was just meeting again with somebody earlier today, and they said, we outsourced our billing to a different company. We have no idea what we're billing on a weekly basis right now. I don't know what I have outstanding, and I can't reliably know what I can expect to be coming in the next couple of weeks. That's a problem. They don't know, they don't understand what KPIs maybe should even be tracked for health of an RCM cycle or a credentialing process and things like that. And I know I am a big fan of your Facebook group. I am on it all the time. Like, I love kind of seeing the questions people are asking. And I know that there's a ton of people who are like, do it yourself, learn it yourself. Those things are all possible. But as a BCBA who has worked clinically and opened up my own company overseas, I do not believe you can both be the clinical expert in your company and the main operator overseeing some of these projects, because they grow in different ways. And I believe, as a woman who is a mother, a wife, I work full time, I have my own hobbies, and I actually have a social life. I wouldn't, you can't do it all sometimes. And so then I think
it's the energy too. MaKenzie has energy for all that.
Oh, she does.
Is I never want to downplay people who want to learn the system themselves, but I think it has to correlate with your business goals. Because if you want to grow and be impacting at a larger scale, I do not believe you actually can also be the owner and operator of those systems within your company.
Yeah. But to your point, MaKenzie, who you outsource to has to be taking management load off of your back, right? So if you're going to outsource as you grow, instead of hiring 3 full-time billing employees, for example, or handling patient responsibility and paring down your claims and handling your CRMs, instead of doing that and having 3 people to manage, because you also can't afford to have a manager over them who you're directly working with, your outsourcing component, you should every week just be getting they should be telling you, here's all of the KPIs. They should be telling you, here's the outcomes of what we've done. They should be handling your entire team that's outsourced, because through outsourcing, you can have more hands more quickly at a cheaper cost. So it shouldn't just be a financial move, although it is. Outsourcing should cost you quite less. Also, the results should be higher, and you should be winning a bunch of your time back, because you're not independently managing a team all day, every day. You don't have a team who's saying, nobody told me what to do on Tuesday, so I've just been hanging out. There is someone doing all of that for you. Those are the core wins. Yeah. And to that point, to the KPI, to Derek's question, Vince, I think it's probably the best person to talk about GCR and why that's important and how you calculate that.
Let's just start with this, Vincent. What is GCR?
Gross collection rate. And I think that gross and net collection rate are tossed around without a lot of people understanding the difference between those two. I'm a gross collection rate person because I like to have my eyes on exactly what I'm billing and what I expect to have back, right? I think that the net collection rate folks are the folks that are out there and they're overbilling on purpose because they don't want to miss a rate increase. They don't want to miss an adjustment, whatever that might be. And so then they're going to have to look at a net because they're going to have to adjust claims off, right? If they're overbilling, you got to look at net. But that GCR number is your collection rate. And so we all know that we're billing on what are typically 100% authorized services, right? Most of us are out there, we're getting our pre-auths, we're getting our ongoing auths. And therefore, oftentimes people go, okay, then I'm going to bill $100,000 and I'm going to receive $100,000. It's not the case. There's so many things that happen between you billing and you actually collecting. And that could be that you have a payer issue. It could be that you had a modifier issue. It could be that there is any number of denials that comes back and you catch it and you rework it. That's great. On the other hand, you end up with a family whose insurance lapsed and you weren't watching your ERAs as closely as you should have been. You weren't watching your GCR. And now you have a kiddo who for 2 months, 3 months has been getting services with no coverage. By the way, when you go to hit that family with a $10,000 bill, they're not going to like it. And so
You're not going to pay.
they're not.
Gonna
You can chase them as much as you want. It's nearly impossible with a family who doesn't realize or who realize that insurance lapsed and they just didn't say anything. That's happening too. So a GCR, I think that our team has historically shot for and hit about 98% insurance GCR. We typically blend it out to 96, 97% by the time that you take into account your out-of-pocket collections, your family collections, because most of the families, you'll get something. You're certainly going to have to fight to get everything. But I think that knowing that we have, again, authorized services, pre-auths, ongoing auths, everything is there. Typically, you're credentialing your staff. You're making sure that as long as all your stuff is there, you should be looking at about a 97% return rate on what you're sending out, right? I think that a few years ago, industry standard was hanging right around 93, 95%. And people were going, yeah, but we could do 98. Come on with us. And that was really the start of, I think, outsourcing and a lot of these big billing companies stepping in. And so we threw a GCR calculator together just to purely let you have a look at, let's say that you're billing 100K this month and next month you get 60K, something's wrong, right? If you're billing 100K this month and you get 80K next month, but you keep watching in the following month, you pull another 10 grand the following month, you pull another 5, and now you're at 95. Okay, you're doing okay, but you're not quite there. And so I do think that folks need to understand their collection rates, because then when they go to budget, if you're budgeting, if you're revenue modeling off of gross billing, then you have severely hindered what your performance will be for next year. You have to bake in what you think you're actually going to collect in that collection allowance. But oftentimes what we are finding is that when we're talking to these early days, or even some of the more established companies that we've been working with, a lot of them are finding their way to 90%. And to me, 90% is almost the gimme number, because we have 6 codes that we're billing. Like we aren't billing a whole lot of CPT codes within ABA. And so again, between an authorization and 6 codes, 90% feels like the gimme. But if you're only collecting at 90%, again, think about that 10% that you're leaving on the table. And I think that's a really big deal. Now, the other side of that math.
How about the difference between what you were talking about earlier, the difference between making a 3% profit and a 13% profit?
That number,
you bill
that
a million,
number almost always
bill $1 million next year. Yeah, you bill $1 million next year, but you only collect 90%. You just left your salary on the table. Your salary is sitting at Blue Cross or Cigna or wherever else. It's not in your pocket.
We talk about that quite a bit with a lot of our companies. That's exactly what we have to talk to them about, is going, hey, 90% sounds great, but yeah, you've left 10% sitting on the table, and that's not great. That's a lot of money sitting out there. And so the math that I like to do is, you want to take a look at what you're paying your own billing staff. And sometimes that's still owner operator. You want to understand what your time is worth, what their time is worth. And then you start to talk to some of the outsourced billers, and you got to find out really what percentage they're going to take, because more often than not, that's what the outsourced billing company wants, right? Is that they want to just set you up on a percentage model, and they go, okay, we're going to take 4%, 5%, 6% off the top of whatever we collect for you. That's often the terms. And that is some of the math that you have to do. Because if you go out to an outsourced biller and they want to charge you 6% and you're collecting 90, and they go, we can get you to 97. Well, what just happened? My value prop has severely disappeared. And so that's the other side of the equation, is that when you are looking at these outsourced billers, not only can you go, okay, great, you can collect at 97, 98%, but you're now taking 6% off the top. This actually hasn't helped me, and I haven't gotten rid of my one biller. I still have my stateside person, and now I'm actually paying more. And so while I do think that outsourced billing, I obviously believe in it, I also believe that you need to really make sure that you're partnering with the right folks and that you're at the right stage to be able to take somebody on at whatever that percentage may look like. But Derek, back to your point, yeah, if you're at 90%, that 13% certainly does disappear quickly, doesn't it? Now all of a sudden you're talking a break even year. That's the difference. That's what we're talking about.
And just a shameless plug, right? Vince talked about 4, 6%, depending on your size. At Ārohana, we charge 2%. We're able to do that because we're of a size that we have enough going on to do that. We're able to do that because we have competent experts and we know we collect really well. We're also able to do that because we have both stateside and overseas folks. And so we're able to triage the cost there and bring that down. We're also able to do that because we are very industry specific, right? So ABA, OT, speech, PT, we are not out there. Vince said it, right? Not a ton of codes we're billing. And so folks who are taking that medical model of outsourced billing, like if you go to just a pure medical outsourced biller, they have to charge 4% because they're thinking, I need to understand all of this pediatric doctor's codes, all of this neurologist codes, all of those things. We are industry specific. We understand these codes. So we're not going out trying to find folks who will understand every single code out there. They just know what we're doing well. And so it allows us to be a lot more efficient. And so I would say if you're being charged 4%, like you're getting taken for a ride.
So what are the things that affect your gross collection rate overall? I know denials, or what are the things to look for to raise your gross collection rate?
Yeah, it is often, it's going to be denials. And we all know those common denial reasons. It's going to be that you get denied for no auth despite having an auth. You could get denied for a missing modifier, a missing taxonomy. And all of this comes back to just making sure that when you're sending your claims, you're sending them cleanly. And what does that take? That takes multiple hands and eyes, honestly. You have to have the team to be able to spend the time and scrub claims before they go out. So I think the clean claims are one thing. I think that the second thing is making sure that you also understand your patients with secondary, right? I've seen a lot of businesses that just don't understand secondary billing at all. And so what happens is that they have a client come in with secondary, they get paid on that primary insurance, and then it has the out-of-pocket amount, and the family goes, I'm not paying that, secondary does, but the company doesn't know what that actually means. They don't know how to send that secondary claim and make sure that they're actioning that all the way through. So that's another big one.
I want to stop you there, Vincent. You can always tell when somebody's an expert in something because they can just lean back in their chair and just but I want to slow you down because you just hit two big things. One is scrubbing claims, and two is secondary. Can you explain both of those concepts, like what happens to scrub the claims before they go out, and then also the concept of secondary?
Definitely. And so when I say scrubbing claims, right, most of us, I think, are between a few EHR platforms. Most of those EHR platforms all get your EDI files set up the same way as well. And
Verification, EHRs, that's your central reach. That's your Aloha, IBA, Passage Health. Those are the things that we're actually utilizing to post the claims.
And so what you want to do, though, is that as you're creating those claims, you want to look at your CMS 1500 forms, right? Before you release that, look at that form. Make sure that you see your modifier. Make sure that the taxonomy code that's on there matches whether it's billing or rendering. And that's another one of those rules that's specific to each insurance. Some of your insurance payers, they want you to bill everything under the rendering provider. Great. I'm going to have my BCBA on every one of those. Their taxonomy codes on every one of those. TRICARE, on the other hand, they want the billing provider, right? Which means that now we have to see everything from the RBT perspective and their taxonomy code and their modifiers and making sure that those are correct. And so scrubbing the claims is that. It's making sure that if you have services within the same day that you're merging those claim lines, because if you have a kiddo in the morning that's got a 3-hour session and then they have a 3-hour session in the afternoon with a different person, but you don't merge those claim lines and you send out 2 claims for March 26th, they're going to pay that first one. They're going to dupe that second one. They're going to duplicate it and they're going to go, oh, we're not paying that. That's a bad claim. And now you're stuck looking at this denial going, why would that be a bad claim? Everything looks clean on it. And you don't realize that the actual fix is that you now need to send it corrected with both claim lines merged. So that's really,
That's just for clarity. So that's just because they assume 2 claims for one for on the same policy and the same day as a duplicate. Okay.
exactly. Because often our claims aren't going with each billing MPI. They go under that rendering. And they're not going with a specific timestamp, and that doesn't matter until they go to audit it and they go, hey, what is this? But you want to make sure your timestamps are still good on your notes too. So that's the big part to me with scrubbing claims. And then secondary policies, right? So you get that first ERA back and the family's got a $4,000 out of pocket, or really that's the deductible numbers that we're now seeing, and out of pockets are in the $7,000 range. But those first couple of weeks essentially all go to out of pocket, or your co-insurance kicks and it's 10% now for the year. And so everything that you get back, it's coming back and it says that it's all PR, and you go to your client and you say, hey, this is what you owe us. And they say, we actually have this secondary policy, or they've already told you about it if they were a good client. And what you have to do is you have to understand how to take the ERA from that primary and connect it to a new CMS claim form and get that out to secondary insurance. And you have typically a timely filing limit on that. So the day that you get your ERA back from that payer, you got to start, because the clock is now ticking, right? From the day that payer says they paid you, secondary's clock is ticking. And if you don't get that claim over to them, they're going to hit you on a timely filing
You
and you're
just
stuck.
lose.
You're stuck.
Yeah.
Thomas.
No, or
Here,
nothing.
like, I position myself like Joe Rogan. I'm talking to people that know a bunch of stuff, and then I ask the dumb everyday average Joe questions. All right. So Thomas had a question, and I think I know the answer to this. Are there any ABA specific RCM companies that do have a value add and justify their fees through collections? I think we're talking to them, but
Yeah. So
Yeah.
Ārohana support literally is that I think we would consider ourselves like a more multifaceted outsourcing company. We do quality assurance for people. We do HR. We do credentialing. We do SEO and marketing. But we believe that where we feel our expertise lies is with the RCM cycle. I think one thing that's challenging for people, I don't know how it's already 9:00. Again, I think it's just easy to talk about the things that we know about. It's 9:00 in California. Sorry. But I think what's hard sometimes for people is when they don't have a deep knowledge of how the RCM cycle works. People want to bring you on board and in a week's time have data that shows X, Y, or Z has improved. And if you've learned anything within the last 50 minutes of talking, it's that data from these things take time to collect. And so it's really also about making sure that your outsourced company or your billing company is setting the appropriate expectations on when you're going to start to see some of these improvements take place. Because say you come on with our Ārohana support April 1st, next Tuesday, and you're like, April 7th, where are my improvements? If we posted claims 7 days after coming on board, what Vince just told us, we have 30 to 45 days before we're seeing those claims come back. And that's not like we're sitting around waiting after those first claims are going out, right? It's an ongoing process. And so we like to tell people that within a good 30 to 60 days max, sorry, that's my dog barking, that we're going to be able to start putting KPI data together that shows the health of your RCM cycle. And so I think it's also a matter of building trust with an entity as well. With Ārohana, when we send out contracts, when we talk to people, it's hey, come on board. Let's do a knowledge transfer. Let's understand what you already have going on. We're going to assimilate into what you're doing. We're going to help improve on what's already taking place. And this is when you're going to start seeing results. We talk people through that. And it really is a company by company basis. I like to joke as the BCBA on the team that it's like an individualized treatment plan for your RCM health, right? Every company is going to be a little bit different in how we approach helping you be successful. Again, I believe if you signed up for the webinar, you'll have our contact information if you're wanting to have a conversation about what your company is currently doing or what can be approved upon within your RCM cycle. But I think at the end of the day, like the reason why Ben, Vince, and I are doing what we're doing is We want people to be able to focus on the clinical quality, what's the services being provided to the kids at the end of the day. Our Ārohana support exists to ensure that clients are getting the services that they deserve and they need. And if we can offload administrative, mental load, weight, and work by doing that and helping them be successful, we know that's only going to increase access to care to more clients.
And your profit fuels your mission. Profit is necessary. We must have a profit.
No money, no
Your
mission.
GCR. Your GCR is straight to the bottom line. You increase your GTR, that's straight to the bottom line. This is one of the fundamentals here. All right, so one more quick question. I don't know if you guys all want to talk about it, but a new BCBA starting up their business, I always tell people, like, build what you can. What are the components that they should be building in their billing system? Knowing nothing, what should they research and establish themselves before starting to work with a consultant or subject matter expert? What are the necessary components?
I think first and foremost, they have to decide what technology they're going to use. I literally had a conversation with somebody earlier this week who they were doing all their claims through an Excel spreadsheet. That doesn't sound smart. It is worth it to invest in some of the platforms that exist that can help make these processes easier. Aloha ABA, Central Rate, anybody that can actually utilize a platform, right? Because if you connect, essentially what you'll do is when you have a clearinghouse like Office LA or Avality, you're going to have EFT set up. They're going to feed electronically into these platforms that are going to allow you to exactly know what's going on within your claims, make posting claims easier, but then also make reconciling the denials a lot more streamlined. And so there's just certain costs you can't get around when starting up a company. And I believe that's one of them. And we've worked with a variety of different ones. There's a lot of people in the field. So I think do your due diligence and decide what platform you want to work for. And then it's a matter of ensuring that you actually are credentialed with the payers you want to be credentialed with, that what your rates are, so you can have kind of that mix, like Vincent said, of understanding what are my rates, who am I credentialed, and then knowing again, who is my contact at this insurance company? Like, find out, get somebody's number, get somebody's email, and like be annoying. Make yourself hurt a little bit within that capacity. And then it's a matter of saying, okay, do I have a process for billing? Because if I don't, who can I bring on board, like somebody like Ārohana support, to help actually develop an SOP for your billing so that you know what's going on, right? Like, we walk alongside companies and we say, this is how we're going to do it. Let's write it down. This is how we're going to handle this section. Let's write it down. So it's really kind of starting there, in my opinion. And again, some people start billing on their own and they very quickly realize I can't have a caseload of 8 clients and also make sure I'm billing on all those 8 clients, right? So it's really about understanding that. And one of the things Ārohana does is we come alongside startups specifically, and we have an even ridiculously lower rate for startups because we believe educating them on how their process should be is worthwhile. And so I believe we also have a pathway for startups to come alongside and work with us as well that not only educates them, but then also makes it affordable for them to have the type of support they need to fully focus on clinical quality.
I love it. You guys are awesome. Thank you for coming on and spending the time with us and answering my silly questions. We do appreciate y'all's time as subject matter experts here. So we do appreciate it. And I look forward to working on the EBCB stuff.
Great.
We'll definitely be putting out some good content there with you guys. So awesome.
Great. Appreciate it. Yeah.
Thank you, everybody. Have a great day.
Thanks, guys.
Thank you all for coming. We'll see you on the group.
Bye.
See you.
You're already doing the work, investing your time, your energy, and your vision. So let's make it count. Build something that works without breaking you. The EBCBA Blueprint is the way. Get started for free with our foundation course.